Hello, my name is Destiny Jackson, and I'm doing a community health presentation on lesbian, gay, bisexual, transgender health. The CDC's government definition of LGBT health is people who are lesbian, gay, bisexual, or transgender are members of every community. They are diverse, come from all walks of life, and include people of all races, ethnicities, all ages, all socioeconomic statuses, and from all parts of the United States. The perspectives and needs of LGBT people should be routinely considered in public health efforts to improve the overall health of every person and eliminate health disparities. My definition of LGBT health is the concern of lesbian, gay, bisexual, and transgender's well-being. LGBT health is in danger due to discrimination and not getting the proper medical care that everyone deserves. LGBT health, to me, is giving the best care to the community that we can possibly give and being a viable source to help the members of the community. Going on with the LGBT definition, you might be wondering where the Q is, and we no longer use the Q because it's more of a slur. If you think about it, it's like saying that you just don't do it anymore, and so we try to keep Q out of there. The community is getting discriminated and being denied services, their own basic rights, and it's being seen as a threat. The result make it so that the community does not get the proper care that they deserve and all that health professionals should provide. The LGBT community is so afraid of rejection and discrimination and bias that much of the population won't get treatment that they need to in order to help them. Why is LGBT health important? So, Healthy People 2020 said that reductions in disease transmission and progression and increased mental and physical well-being is one of the reasons why it's so good to help the LGBT community. It can reduce healthcare costs, which if we just prevent it beforehand, it can be a lot cheaper than actually treating it. And of course, it increases their longevity. Healthy People 2030, health-related quality of life and well-being, says that promoting quality of life, healthy development, and health behaviors across all life stages. This wasn't directed towards the LGBT, but I felt like that I agree with it for the LGBT health. It is to promote their quality of life and health development in all of their life stages. My input is if we can raise enough awareness of their health that maybe they can get the health care that they all deserve. Discrimination in the LGBT health community. More than 1 in 5, 22% trans people have avoided seeking health care due to anticipation of discrimination or poor treatment. And that is by Casey Logan. The community is, if there is more than 1 in 5 avoiding healthcare due to expectation of discrimination and not feeling approved, they aren't making their health a priority. And if you're never showing up to a provider's office because you're discriminated against every time you go there, then that hypertension that you have might never be diagnosed. Even though you got it when you were 35, but you'll get a heart attack or stroke at 65 or 55. Or someone might skip a screening that would have detected cancer. And that was by Dr. Lung, which was said perfectly. As a patient advocate, we should be able to stand up for people and for their proper health care for the LGBT community. Refusal of service. In some states, there is a law stating that it is okay to refuse a patient based on their gender, identity, or sexual orientation. So healthcare workers are allowed to refuse a patient in the healthcare situation. We as health professionals have a basic unit standard of care, and we agree to help and care for patients and not turn them away just for something that they cannot help. The reason they have the right to refuse in some of these states is based on their religion, moral, and then also the lack of knowledge they might have. But it can also be because of discrimination. And then this quote from Ryan Thorson, including administrative or technical personnel to refuse to perform a task because they can identify some connection, no matter how attenuated, to a service they consider objectionable. For example, a hospital room scheduler might well be able to refuse to book a room, or a technician refuse to clean a surgical instrument for procedures they consider objectionable. This is saying that anybody can find a reason if they try hard enough. And, if you think about it, a teacher does not refuse to teach to an LGBT student, so why should we have the right to deny someone of treatment in a hospital care setting? So then I also put on the side, what is the change we want to see in refusal of service? So I have prioritize, authorize, and initialize. My priority is that there is no more refusal or service for our LGBT. This is what I personally want. And then if we just refuse this, we can authorize. Authorize by teaching all health personnel about their LGBT health and how to administer that. We can initialize this by starting to change. Medical education is constantly changing, so let's get more data to help with the LGBT community. I got some statistics. So the LGBT youth are 2 to 3 times more likely to attempt suicide. LGBT youth are more likely to be homeless. Lesbians are less likely to get preventative service for cancer. This is because they're most likely not to come in due to discrimination. Gay men are at a higher risk of HIV or other STDs, especially among communities of color. Lesbians and bisexual females are more likely to be overweight or obese. Transgender individuals have a high prevalence of HIV, STDs, victimization, mental health issues, and suicide, and are less likely to have health insurance than heterosexual or LGBT individuals. Elderly LGBT individuals face additional barriers to health because of isolation and a lack of social services and culturally competent providers. LGBT populations have the highest rates of tobacco, alcohol, and other drugs, and this is for Healthy People 2020. So this slide is all about gay and bisexual men's health. Gay and bisexual men are more prone to HIV than STD, and it is more common for them to have depression, tobacco, and drug use. So some prevention that we can help for this is test for HIV at least once a year, syphilis, hepatitis B, hepatitis C. If you were born between 1945 to 1965 or with risk behaviors, chlamydia and gonorrhea of the rectum if you've had receptive anal sex or been a bottom in the past year, chlamydia and gonorrhea of the penis if you had inserted in anal sex or been on top or received oral sex in the past year. Gonorrhea of the throat if you've given oral sex in the past year. Some ways to help. Hepatitis and HPV vaccinations are highly recommended. Some ways to lower your risk of STDs is talk honestly with your partners about STDs and getting tested. Before you have sex, use a condom correctly and use one every time you have sex, and limit your number of sexual partners. Of course, this is a recommendation. Some other ways to protect your health are talk to someone if you are feeling depressed. Care for your mental health. Your diet, exercise can help with those situations. Don't smoke and limit your alcohol consumptions. This slide is all about lesbians and bisexual women's health. Lesbian and bisexual women's health have some issues to look out for, like breast cancer, depression, heart health, tobacco, alcohol, substance use, intimate partner violence, and sexual health. The Johns Hopkins Medicine Health said that lesbians and bisexual women are most likely to smoke, drink, and have substance abuse more than heterosexual women. Intimate partner violence can happen in their relationships too. However, doctors are less likely to ask about the violence, unlike the heterosexual relationships. There is a higher risk of breast cancer. It is good to get a screening regularly. Lesbians and bisexual women are more likely to be obese or overweight, so it is good to look out for a heart-healthy diet and also by exercising. Lastly, lesbians also get STDs but are less likely to go to a doctor. It is good to get some screening for them. This is about the transgender health. So imagine having to teach your doctor about common health issues. Well, transgender health. AMSA states that over 29% of trans women and men must explain what doctors should look for when talking to them. Depression, HIV, alcohol, drugs, smoking, and attempted suicide, and suggestion of medical and surgical therapy are common health issues in the community that would benefit their health. So I just wanted to go ahead and explain. A trans woman is when a man does not feel like they are in the right body, the right gender, and that means they want to change, and they want to change into their true selves, which is a woman. They go by she and her. Trans men, when a woman does not feel like they are in the right body or the right gender and change into their true selves, also known as a man, he, him. Then there's also gender neutral. That is an individual who does not feel like a man nor a woman, and they are just themselves. They're human. They go by they, them, and I know that can be some confusion for a lot of people. So have it this way: if you found someone's dog, you don't know who they are, you don't know their gender. So here's this sentence. It says, I found someone's dog. They are probably worried. I will return their dog to them. Some ways that we can help the transgender community. So I have a graph here. We have easy to affordable, which is leaving a blank space after the question on gender or offering a transgender option on intake forms. So this could be an easy yet affordable fix. Then we have the easy but quite expensive is the gender neutral backgrounds. And then we have the expensive and kind of hard to get, but hopefully one day we can get there, is we can teach the healthcare personnel about LGBT health. And maybe we can get it into some schools and universities. Affordable, but yet can be some hard, is gender neutral language, such as partner when asking about a patient's sexual or relationship history. This can be hard because after going years and years explaining if they had a wife or a girlfriend or a boyfriend, it might as well go to partner, and changing also to they, them if they feel comfortable for that. I know after a long time of not saying that, it can be difficult to learn, but it is free and it does help enormously with the trans people and the community. And then how are we helping right now? So right now we are helping by adding anti-bullying policies to schools, reducing suicide and homelessness in youth by providing supportive services. We are having some prevention of providing HIV and STI interventions. And lastly, we're trying to gather more data, gathering more information for health-related surveys in order to present the community's disparities. We are also providing some education, having the discussion to be appropriate, active, and supportive of the client's sexual orientation and their identity to improve patients' interactions with their healthcare team members, training medical students to be culturally competent. So how can you help? You can spread the word. Let everybody know what you learned today. LGBT health needs to be focused as just as everybody else. The LGBT community has in common tobacco, drug, alcohol abuse, depression, and suicidal tendencies. So you as a nurse should be on the lookout. Be there for your patient and advocate for them. Be the reason they are willing to come and seek out healthcare. And here's my sources. And thank you.